The orange material flaps in the wind while creating a wall of sorts around Mandera County's cholera treatment center, separating it from Mandera County Referral Hospital. Only a few people are allowed in here, and only after careful screening and disinfection. Then the door opens to reveal the makeshift wards, the patients in various stages of illness on the makeshift beds, with holes cut out in the middle for hygiene purposes. Medical workers here grappling with the sheer number of patients coming in. Since the disease broke out in April, 15 people have died and 893 patients have been treated here.
Cases that we are meeting on a day are 50 to 60. And it's quite a big toll, a tall order actually for medical staff to receive these, resuscitate them, admit them and ensure that they are stable and discharged home.
91 patients are still admitted as the epidemic rages on. The first case of cholera in Mandera this year was reported in April, a traveller from Nairobi.
The patient presented herself to a private facility on the 12th of April, and the private facility did not immediately suspect that it was actually cholera and rather treated the case as a normal, diarrhea.
Since then, the waterborne disease has spread fast through several homesteads, despite a ban on eating at public social events, frantic efforts to treat water sources and disinfect homes where cases of cholera have been registered. The outbreak of yet another disease now complicating the situation. The canes that residents walk around with are an indication that they are probably recovering from Chikungunya, a viral disease that is spreading fast.
Chikungunya kwanza mimi mwenyewe niko nayo. Mimi, watoto wangu, mama, watoto, wote tumepata.
The name Chikungunya originates from the Kimakonde language of Tanzania and means to become contorted, bent over as patients often are from the pain.
Tunafikiria hii ugonjwa imeingia hapa kutoka upande ya Somalia.
Chikungunya is caused by a mosquito bite. And this type of mosquitoes, unlike the one for malaria, they even bite during daytime.
Symptoms appear between 4 and 7 days after the patient has been bitten, and they include high fever, debilitating joint pain and swelling, headache, nausea and fatigue. While chikungunya is rarely fatal, it has no cure, and doctors can only treat the symptoms.
In a household of maybe 6-7 people, we have large households of 6 to 7 people, you'll realize either all of them are down or 4 to 5 of them are down with chikungunya.
The disease clearly taking its toll, with over 500 patients reported in Mandera so far.
We have 50% of our staff who are currently involved in delivery of healthcare services are down with chikungunya.
The complex issue is the population is already dealing with cholera. And now you are immobilizing the population further.
On Tuesday, 11 medical workers arrived in Mandera to provide additional support. In the face of the two diseases, the county hopes to contain cholera within the next 3 weeks. Wilkisanyabwa, Citizen TV in Mandera.